طيب ريحوا كده شوية كده لمدة دقيقتين. كل سنة وانتم طيبين أولا، وسعيد إن أنا معاكم النهاردة في أول يوم رمضان. يوم صعب شوية، أنا عارف كلكم عايزين تشربوا كوباية قهوة، وأنا كمان بصراحة يعني. آه، تحبوا تسمعوا الأول؟ إحنا عندنا النهاردة 3 محاضرات ورا بعض. تبتدوا بالبيدياتريك ريتنال ديتاتشمنت، ولا تبتدوا بالفاسكولايتس، ولا تحبوا تبتدوا بإيه؟ ولا كل واحد؟ اوكي، طيب نبتدي بالبيدياتريك ريتنال ديتاشمنت عشان ده موضوع لطيف حقيقي. اوكي، مين شاف young or a child with retinal detachment؟ اكيد كلنا شفنا، بس يعني معظم الحالات الحقيقه بتبقى اللي بتيجي mainly traumatic. بس انا مش بتكلم على traumatic خالص، انا بتكلم على what I'm going to present to you is a different sector of patients. So لو اتكلمنا كده, retinal detachment in children is rare, but it's a serious problem because it's really a vision-threatening complication because of the late presentation. العيانين دول بيجوا عادة متأخر قوي، أو بيجوا نتيجة لأن العين التانية راحت، اللي هو بيشوف بيها ابتدت تتأثر، وعين already very advanced. and difficult examination. العيان عندنا مشكله مع الاطفال، ان الاطفال الدكتور هتروح للدكتور هيديك حقنه، فالطفل بيجي اصلا خايف من الدكتور، والدكتور اديني حقنه مش اديني حقنه. ف this culture of scaring the children is there, and many of those patients are developmentally abnormal. Either they do not dilate, او عندهم an opacity, either a cataract or whatever, or glaucoma. هنعرف دلوقتي. Okay, so ده كلام معروف. Retinoschisis detachment، احنا بنتكلم اساسا على retinoschisis. We have the traumatic or non-traumatic. We are going to concentrate on the non-traumatic because they constitute a special sector of patient and a special division of those cases. exudative احنا عارفين العيانين عندهم retinal، عندهم uveitis and tractional ROP. سريعا كده نتكلم على traumatic. Usually you either blunt trauma, and these present with retinal dialysis or macular holes, and those patients have a glaucoma because of the blunt trauma. Or you have the penetrating injuries. والعيانين دولت really they go down the hill very quickly because of the very florid fibroproliferative element involved, and they get anterior and posterior PVRs, and usually difficult to manage. طيب, what we concentrate on are the sector of non-traumatic retinoschisis retinal detachment. احنا نقسمهم into those categories, either inherited, congenital anomalies, or idiopathic. Inherited disorders mean that there is a mutation, there is a gene defect involved. وأهمهم are Stickler syndrome, مرورا and passing with the X-linked Retinoschisis and Marfan syndrome, and the subsets of Stickler syndrome, or the congenital anomalies like congenital cataracts. Congenital cataract، أيوة العيانين بتوع congenital cataract بيجي لهم retinal detachment later on. Or glaucoma, patients with congenital glaucoma, and the category of congenital myopia, and the idiopathic form, the infratemporal retinal dialysis. Myopia is quite prevalent in this sector of patients. والعيانين دولت ممكن يكون عندهم دي تجميعة للincidence of myopia because the incidence of myopia is quite high in these patients. طيب نبتدي بالستيكلر syndrome. مين شاف عيان بالستيكلر syndrome؟ Okay, so Stickler syndrome is actually not uncommon, and it's an autosomal dominant inheritance with ocular, articular, and auditory anomalies. يعني it's a multi-system disease. عشان كده بنسميه syndrome. So what is the problem? It's the type 2 procollagen. There is a defect, mutational defect in the synthesis of type 2, which is a common collagen between the bone and the cartilages and the vitreous as well. So they have those both the collagen, the gene defect is collagen 2A1 gene defect. This constitute the Stickler 1 syndrome. Or في Stickler 2? Yes, there is another Stickler 2 وفي Stickler 3 بس ده Stickler 3 ملوش أي دعوة بالocular manifestations and the ocular complications. Stickler 2 there's a defect in collagen 11 synthesis, and the difference between both is that Stickler 2 has a different finding. أنا بس أوريكم this is my first Stickler patient or Stickler family. الحقيقه العيان دول العيانه دي جت لا هي دي دي جت with retinal detachment in her only seeing eye. لما فحصناها لقينا عندها long standing retinal detachment in one eye. She developed a retinal detachment in her only seeing eye. And then taking the history, her father has a retinal detachment in both eyes. طلبت اشوف العيله لقيت واحد منهم ده كان عنده retinal detachment in one eye. One of her sisters here had retinal detachment in one eye, and this is the my first Stickler family. So another Stickler family show all the generations. شايفين المنظر اللي شايفينه the flat facies, the low nasal bridge, وعندهم يعني other articular manifestations. So and high myopia. العيانه دي, this is the mother, she's blind. She had the retinal detachment in one eye. This is one eye seeing 160. This is her daughter, bilateral retinal detachment, bilateral retinal detachment. This is the grandmother, blind in one eye, very high myopia, this typical Stickler syndrome, high myopic eye, minus 10 or minus 11. So, ايه بقى systemic manifestations and findings? Usually they have this facial, very characteristic, no matter where you are. في السودان، في اليمن، في الصين، في مصر، في ألمانيا. This is the typical facies of Stickler syndrome. The flat nasal bridge, the wide كده facies, and of course the oral بيلاقي عندهم high arch palate, sometimes some cleft, and the joints are very flexible. وساعات وتلاقيه ماشي كده رجليه عماله تلق كده هو الركب بتاعته. If you see a patient, you'll never forget these patients with joint. بس طبعا the phenotype is different from one patient to the other. So this is part of the typical Egyptian family. This is the boy here ده عنده bilateral retinal detachments. His sister bilateral retinal detachment. His mother اللي احنا شفناها في الأول bilateral retinal detachment with one only seeing eye. طيب ايه الفايندنجز اللي بنشوفها في العين بقى؟ Large globes, myopic patients. These are high myopic patients. And the characteristic clear vitreous. يعني ايه clear vitreous؟ يعني نبص كده بالسليت لامب نلاقي الفيتريس is empty. نسميها empty vitreous. But at the anterior part in Stickler 1, we have the so-called retrolenticular membrane. This is type 1. Type 2, بنلاقي a bulbar condensation and behind it clear vitreous. غير الفيتريس اللي احنا عارفينه اللي هو بنلاقي فيه fibrils, collagen fibrils. These patients have this characteristic clear vitreous. And they have peripheral retinal degenerations and quite often lens opacities. طيب ايه بقى المشكله؟ retinal detachment is so prevalent in these patients. يعني ايه؟ more than 70% of those eyes develop retinal detachment. والاخطر من كده هو bilaterality. So almost 50% will develop retinal detachment. طبعا these figures are يعني very 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 alarming. طيب Stickler syndrome clinical presentations. If you find a child presenting with giant retinal break, this is Stickler syndrome. So giant retinal breaks is quite prevalent. Bilateral giant breaks is quite prevalent. And bilateral retinal detachment is quite often the clinical presentation of these patients. وده اللي احنا بنشوفه ده بالظبط عيان ستيكلر. عيان ده عنده ايه؟ A typical giant retinal break. Okay. There are other subsets. اللي احنا بنسميها كوندروديسبليزياز، زي كنيس سندروم. انذر عندهم العيانين دول بيبقى دورف وعنده سكوليوزز وعنده مشاكل في المشي، اور ذا فايسنباخر سباي ميلر سندروم، نوبلاخ سندروم، مارشال سندروم. كل دول سبسيتس يعني لهم mutations, and again they are ophthalmoarthropathies with incidence of retinal detachment and high myopia. نيجي بقى الموضوع other cause of retinal detachment is the Marfan syndrome. Marfan syndrome كلكم شفتوه، مين ما شافش؟ صعب يعني، موجود quite prevalent يعني. So it's an autosomal dominant. The effect, it's a fibrillin production. Fibrillin is an important for the connective tissue. So fibrillin 1 gene defect is the problem, and they have systemic manifestations with ocular and retinal detachment. Why retinal detachment? على فكرة retinal detachment in Marfan is not uncommon لكذا سبب. These are myopic eyes in most of the cases, and many of those eyes had already cataract surgery done, whether lansectomy or whatever. This increases the risk. احنا عارفين cataract surgery increases the risk of retinal detachment even in normal eyes. So you have retinal detachment in the second decade of life. Type. These are some of the patients, the typical Marfan, صوابع طويلة, and some of my patients have so long, هوريكم دلوقتي faces وطويل and have long fingers. زي العيان ده بقى another patient. These both patients had bilateral subluxated lens with bilateral retinal detachment, and they develop retinal detachment later on. Another form or another cause of retinal detachment in children is the coloboma of the choroid and the retina. أكيد شفتوها بردك. Sometimes is unilateral, sometimes is bilateral, but retinal detachment is again a common problem in these patients, and it can develop in almost 40 to 50% of patients with coloboma of the choroid and the retina. Where are the breaks? ليه بيحصل retinal detachment؟ حاجة من اتنين، يا إما بيجي لهم posterior vitreous separation with a peripheral break rare، أو بيحصل لهم inside at the edge of the coloboma a break or a macular hole. Macular hole, أيوة. There are studies which actually reported macular holes in these patients. So you have different types of breaks, and the problem is what? Is to find the break. شايفين? It's very difficult to find the break in these patients. فالعيانين دولت in most of the cases they need a vitrectomy. Infratemporal retinal dialysis. مين شاف infratemporal retinal dialysis قبل كده؟ Okay, so this is an interesting disease. ليه؟ لأن العيانين دولت are emmetropes. عيان طفل عادي خالص. بفحصه ألاقي عنده إيه؟ ألاقي عنده inferior retinal detachment, sometimes bilateral retinal detachment, mostly long-standing. ليه بقى long-standing؟ لأن it's very slowly progressive. ليه بقى المشكلة؟ They have a defect at the periphery of the retina, and there is a dehiscence of the retina at the extreme periphery at the ora serrata. So young males, emmetropes, bilateral, examine the patient properly, inferiorly, and they have a very slowly progressive retinal detachment, usually undiagnosed until both eyes are affected, and they can develop bilateral retinal detachments with demarcation lines and retinal cysts type. The other form of pathology which can develop in retina in these patients, the pediatric group, is the X-linked retinoschisis. مين شاف X-linked retinoschisis؟ Not uncommon، بنشوفه. طيب لكن most of those patients actually present with either defective vision or vitreous hemorrhage. ليه؟ لأن the schisis causes vitreous hemorrhage, but retinal detachment can develop if they have an inner and an outer hole. ممكن؟ Yes. So they can develop the retinal detachment if they have both, and this is not uncommon. So If you go into X-linked juvenile retinoschisis, you have it's an X-linked recessive, mostly boys, hyperopic males وعادة hypermetrope زائد 1 زائد 2. They have a bilateral defective vision. ليه defective vision? Not from the retinal detachment, but from the foveoschisis. They have foveoschisis, and part of the X-linked juvenile retinoschisis is that the fovea is affected, so they have defective vision. What is characteristic is the foveoschisis without any leak in the fluorescein. All right, so we have an infratemporal vitreous vase, macular involvement with foveoschisis with peripheral retinal degenerative changes زي ما انتم شايفين هنا اهو. X-linked retinoschisis ده عيان من العيانين بتوعي with retinal detachment due to outer and inner retinal breaks. And the treatment is by vitrectomy, and they do very well with vitrectomy. Congenital glaucoma. So congenital glaucoma can cause retinal detachment in children. Why? Huge eyes. So they are myopic eyes, actually. And they have a very large globe, but the management is quite difficult. ليه بقى؟ Media opacity, they have HAPS stria, the cornea is not very clear, they have cataracts, they have a thin sclera if you want to operate, and even if you go ahead and do a surgery, whether sclera buckling or vitrectomy, ايه المشكلة؟ The intraocular pressure. They already have a compromised disc, and then the pressure rises post-operatively, and you lose the vision from glaucoma, not from the retinal detachment. So they have a visual prognosis, but they are operable, and you can encounter those patients. So congenital glaucoma is not uncommon. Retinal detachment is not uncommon in congenital glaucoma. Congenital cataract. عيانين اللي عندهم congenital cataract, they have been operated, are at risk of developing retinal detachment at the second decade of life. Why? These are sick eyes, and they have over this risk factor another risk factor, which is the operation of cataract surgery. So these patients, لو انتوا شفتوا العيانين دولت, are myopic patients. They develop myopia later on as a compensation. They have a delayed manifestation of retinal detachment, and they have media opacities, whether a posterior capsular opacification or some of them they have fibrosis along the intraocular lens. So the visualization is difficult, and glaucoma is not uncommon. So they can develop retinal detachment, they can develop glaucoma. Retinopathy of prematurity. Yes, there is an aborted type of retinopathy of prematurity, which develop later on. These are myopic eyes, and they have such a dichtopia of the macula, they can develop delayed retinal detachment later on in life with a combination of tractional rhegmatogenous retinal detachment. Familial or fever, familial exudative retinopathy, مين شاف؟ Fever. Again, موجودة. It's not rare as you think it is. So it is an autosomal dominant disease. Myopia is common in these patients with the peripheral retinal non-perfusion. So it's a form of retinopathy of prematurity in the adults. ايه المشكلة؟ They develop peripheral traction, they develop peripheral exudative detachment. زي العيان ده, this is a family, 2 boys with an exudative retinal detachment at the periphery here and severe neovascularization, and actually they developed vitreous hemorrhage later on. Retinal detachment is not very common, but tractional detachment can take place in patients with fever. العيانين دول, these are the brothers, and the peripheral ischemia and the peripheral exudative retinal detachment. So pediatric retinal detachment is underreported, and you really need to have it in mind لما تيجي تفحص عيان وتلاقي طفل عنده retinal detachment. And I'll share with you some of my patients. العيانين بتوعي, I have a large group of patients. Most of them are Stickler syndrome, and the systemic findings are quite common in these patients. Systemic findings is a very common finding. And family history of retinal detachment is very common, particularly in patients with Stickler syndrome. And look at the type of retinal breaks. So we have giant breaks is quite common in patients, in these patients, group of patients of pediatric retinal detachment. Myopia is quite prevalent, high myopia, quite prevalent. And the fellow eye, which is the critical thing, a fellow eye, if you have to examine the other eye, if you have a patient with a retinal detachment as a child, examine the other eye. You will be surprised because you will find that 40% of my patients had retinal detachment in the other eye, flat retinal breaks in another 15%, and other findings like cataract and so on. So examine the other eye. And the frequency of ocular pathologies is not, again, cataract and glaucoma, quite common. Okay, so what to do with pediatric retinal? If you find a patient with or a child with retinal detachment, buckles. I'm really very sad when I find a patient or a young boy with a retinal detachment which has been operated by vitrectomy and silicone oil. Many patients with pediatric retinal detachment can be buckled. Why? Because if you examine the patient, you will find the break apart from PVR. لو عيان عنده PVR ده موضوع تاني، لكن العيان الطفل الصغير دون he can be buckled, and buckles are very valid in many cases. But you need to do sometimes vitrectomy, and I combine that with a buckle in order to support the peripheral retina. So vitrectomy is the operation of choice in patients with PVR or giant retinal breaks. طبعا giant retinal break ما ينفعش اعمل فيه buckle خالص. There's a problem in these patients is the posterior hyaloid is very difficult to peel, and the problem of PVR. زي العيان ده مثلا, this is a patient with Stickler syndrome, and if you look at this patient, العيان ده عنده a typical very large peripheral break. If you try to remove or peel the posterior hyaloid, even using the triamcinolone, it's quite difficult to remove. And this patient in particular had a vitrectomy with silicone oil, PVR, very large break peripherally, and it ended up with a good surgery. The problem in sometimes you face is the hypotony and the choroidal detachment, which you have to drain before doing the surgery. مش هنخش في التفاصيل قوي. So in كده, to sum up, clinical features of pediatric retinal detachment, bilaterality is common. So if you have a patient or have a child with retinal detachment, examine the other eye. There is a high incidence of family history. وده معناه ايه؟ I need to examine the whole family. تعال وريني اخواتك ووريني بقيه العائله. You will be surprised of what are you going to find. And the association of systemic anomalies is quite common in these patients. دول مجموعه من العيانين بتوعي, and they have these special features. This is a patient of mine with bilateral retinal detachment, huge eye, is -20 in both eyes. He had a bilateral retinal detachment, operated successfully, alhamdulillah. These are the patients. Again, Stickler patient here, typical. Another patient here, bilateral retinal detachment. This is a special form of, and مقلتوش بس this is a special form of syndrome. حد يعرف يقول ده ايه؟ لا, ده اسمه SOX4 syndrome. SOX4 syndrome. SOX4 is the gene which is responsible for the development of the eye. So these patients have a defect in these are patients with an anophthalmic eye in one side, and these are not uncommon, بشوفهم كتير. And this patient, and the other eye has a choroidal coloboma and a retina choroidal coloboma. So, and a defect here in the fusion lines as well, with a huge cleft palate, the SOX syndrome. If you this is a patient انا بعتز بيه, العيان ده مهندس, he has one eye lost, he's a Stickler patient, and I managed to save one eye, and he is now working as an engineer. I'm following his children because they have also Stickler syndrome. So these patients, if you solve them, they can have a normal life. Okay, prevention of perspective, identification of patients at risk. So you have to screen the rest of the family. Very important. افكركم بالعيانه بتاعتي دي والعيله بتاعتها. If I did not screen the family, I would not have found the other members of the family and saved their eyes. المجموعه دي من العيانين. These are patients. Again, a family دول عندهم infratemporal retinal dialysis. These are the boys, bilateral retinal detachment. I asked for the rest of the family, and even the sister had bilateral retinal detachment as well. So, is there a role for prevention? Yes, there is a role for prevention. They mean the fellow eye. Number one, consider prevention in the fellow eye and other members of the family with positive findings. يعني لو فحصت بقية العيلة ولقيت العيان عنده findings suggestive Stickler syndrome, yes. So what to do? What to do is to do a 360 degrees either laser, photocoagulation, or cryotherapy. Well, by reports, this is evidence-based medicine. This maneuver or this procedure decreased the incidence of retinal detachment from 72% to 8% in the patient population. So if you find a patient with Stickler syndrome, fellow eye, do laser or cryo, confluent cryo, or the same procedure in the other members of the family. وشكرا جزيلا. أسئلة؟ كل حاجة ملك. ازيك يا ملك؟ Any questions? Okay.